HIV is just an attack on the immune system. By the attack we mean, usually, human immune system has the capacity to take care of any invading diseases. However, in the situation of HIV, the immune system is usually compromised. Compromised in the sense that the virus has attacked the immune system, so the immune system is not functioning as it should function. That is why it is so described. AIDS is acquired immune deficiency syndrome, which is as a result of a full-blown HIV turning to AIDS disease. The history of HIV/AIDS has been on for a very long time, in the 80s, when the virus got introduced to the whole world. That time, people came down with various kinds of illnesses, from fever, headache, losing of weight, people not eating well, and so on. And if this continues for some time, 2 weeks, 3 weeks, and you are tested through the hospital system, and your blood is taken, either HIV 1 or 2 is detected, you are now said to have HIV. And when it develops to a bigger, when you don't take care of it, it develops to AIDS, which is the bigger form of it. That is when you are not undergoing treatment. But it is very, very important to share with you at this stage that the HIV virus, which is managed by the use of retroviral, we have very simple food materials that are common, that have the capacity to improve on the immune system. Because in the HIV, immunity is the issue. The ability of the immune system to take over the management of the entire human system and deal with the invading HIV/AIDS is the most important issue. And while it is doing that, it will be depleting the virus in the blood. The virus is usually termed as viral load when they are detected in the human system. So for the purpose of this, we will not speak too long grammar. The essence of this is introductory, so that if you are interested in our packaged lectures, you can now join us through the various packaged lectures, where a number of these lectures will be taught to all groups of people who will be able to prepare some of these simple plant materials, food materials that we have that can boost the immune system. A number of these are bitter leaf, ugu leaf, hospital tufa, apple, onion, and so many others. They come in handy. In our earlier introductory remarks, we have already done this. The principle of their combination will be taught you in the different lectures that have been prepared for delivery. As of now, these particular combinations have been able to bring down the HIV load to 0 in the human system. So we should not ignore phytomedicine. And as a matter of fact, how did other medicines come about? They came into the development of the specific ingredients, which is isolated and then mass produced for human use.